my question is, if you become the Minister of Health, what will you do to ensure, being a kidney expert, to ensure that we have efficient kidney centers so that Nigerians in the future will not have to travel abroad? Thank you.
Distinguished senators, I'm very happy, quite impressed with the variety of questions that have been posed to me. This just vindicates my impression of this august house, that we're very, very passionate, dedicated Nigerians are assembled to really move our country forward. Most of these questions are actually, they fall within one way, which is just, we don't have a healthcare system now. It's really suboptimal. Except for the question that Senator Yaradua asked on liability insurance issue, I'll address that later. And the other question from Senator Abu Fatai Buhari on the JAPA syndrome, I'll come to those two. But the other questions falls within one main category of what we have now is not working the way it should. I'm a fervent believer in private sector driven healthcare economy. That is how we can fix it. We need a very good payer system. If you don't have a payer system, you cannot fix this healthcare system. If we continue to do what we're doing now, where the larger chunk of the funding is coming from government, they say if you do the same thing, don't ever expect to see a different result. You will see the same result. We need a robust payer system. I would like to commend the 9th Assembly. They did something very futuristic. They passed 2 landmark bills: the expanded National Health Insurance Act and the provision for the basic healthcare provision fund. This is really, these two bills, we can really use it to create a linchpin, a launching pad, how we can build a very robust payer system. What we now need to do is to encourage international insurance companies to come into the country to support, to complement these small, scattered third-party payers that we have today. Big multinational companies like United Health, Humana, Cigna, Local Blue Shield of Illinois, they will come. We have the population. Once we start getting these international companies to come, they will bring the technology, funding, robust platform to complement what we have. What we will quickly see is that we will have a private sector where we have a huge sum of money going into the pool, and then the National Health Insurance Scheme can now begin to function as a regulator of the private health insurance sector, and then act as the operator of the government part of the scheme, because we already have the basic health provision fund that has dedicated a pool of money to vulnerable population, young kids, infants, mothers, elderly. So we can use that money to fund those vulnerable groups. So what we would quickly get to, we will have what operates in America today, when you have the Center for Medicare and Medicaid Services, taking care of the vulnerable group, and you have robust private payer system taking care of the other people. Once we've done that, we now have enough resources coming into our system. What we're worried now about JAPA syndrome, doctors going abroad, would naturally start to get better. I'm a physician, and I'm not trying to be very partial here, but I know with certainty, anybody that trains to be a doctor wants to serve humanity. Care for their patient. It's not about money alone, poor economy, but they don't have the adequate infrastructure to care for their patients. It is very, very frustrating. And that's why we see this massive outward migration of doctors out of the country. We need to fix our healthcare infrastructure, and beyond that, compensate our physicians adequately. We also, to now begin to address this JAPA syndrome of people going out, once you adequately compensate your physicians, fix infrastructure, you provide an enabling environment for them to work. Now, we also have to start engaging our diaspora doctors, engage them to come. Once the right environment is created, they will come. And lots of people they will want to serve our country. Now, beyond that, we also need to quickly increase the pool of the doctors we're producing. We have about 50 medical schools in the country. Government can provide special funding to these medical schools to double the number of doctors that are being produced. So, on that. Now, I would like to quickly talk on a very, very important, Senator Alausa, sorry, you said something about how can we get the sub-national government to take care of the primary and secondary health care system. Now, the federal government cannot force the local government beyond the federal funds being allocated. The federal government cannot force them to do what they have to do. But what is lacking here is there's the National Council of Health, which should be a meeting of the federal minister and the government, where really health policy issues should be discussed. This council is not functional. They meet probably once a year or twice a year. This is not optimal. The National Council of Health should be really re-engaged to serve its purpose, and that's why we can get the sub-national government to do their role, to do what they need to do in terms of primary care and secondary care. Now, Senator Alausa, you asked a very important question of the way medical liability. Now, literally, there's no regulation. Anybody can just, any healthcare provider can just kill a patient. Nothing happens. Nothing happens. There's literally no consequence. We can't operate a healthcare system like that. We need to set up, like what obtains abroad, quality regulatory boards at the federal and at the state level. These quality regulatory boards would actually begin to credential and certify healthcare facilities, and patients who felt they haven't been treated well can report to those boards, and then the medical practitioner license will be withdrawn, will be suspended. Once that begins to happen, people will be accountable for their actions. That's one thing that is lacking, and we need to do. Also, you said something that is very passionate to my heart. This is what I do with the lack of kidney care centers here, namely dialysis clinics and transplantation service in the country. It's about you don't have the funding. Averagely, one session of, even in Nigeria today, one session of dialysis cost about 25,000 naira. If you have to do at least, at standard you do 3 times a week, Nigeria they do 2 times a week. That's 50,000 naira a week. In a month, 200,000 naira. Even if you're a multi-millionaire and continue to do this, you will expend your money. One of the major causes of bankruptcy in the world is lack of health insurance coverage. Once we now have a robust payer system where the insurance pay for the dialysis, they pay for transplant, clinics will spring up. This is business, they follow where the money is. We can now begin, what we have now, our healthcare sector is only contributing less than 2.5% to our GDP. We need to really invite more private involvement, where we can quickly increase year by year contributory GDP by 5%. If we're able to do that, in 4 years, we can get our GDP to the GDP get GDP to about 22%, where we have the health sector contributing to it. Today, in America, 22% of the GDP there, and the healthcare accounts for 22% of GDP. That translates into $3.3 trillion spent. If we're able to do the same thing here, we can quickly bring in a lot of money into the healthcare sector, and what will happen, we'll create a healthcare sector that is even bigger than the oil and gas sector. And what will happen compared to oil and gas? Healthcare sector, it has a heavy need for manpower. What we can quickly do, if we get to that level, now we engage a lot of young unemployed citizens coming into the labor force, getting the same job, paying government taxes. We can do this. We just have to have focused leadership to get this done. I hope I've answered all the questions.
Not totally. I see the hand of distinguished Senator Idiot. She's representing Lagos. Maybe there's something you did in Lagos that she wants to bring forth.
Your Excellency, the Senate President, distinguished colleagues, before you is Dr. Tunji Alausa, a health practitioner of decades of experience